Hello, I'm Dr. Stephen Blatt. I'm the Medical Director for Infectious Diseases at TriHealth, and I've been at TriHealth for around 30 years, and we're here today to talk to you about a new multi-specialty bronchiectasis clinic that TriHealth will be providing for the community.
My name is Khawar. I'm one of the pulmonary and critical care physician here at TriHealth, specializing in bronchiectasis and non-tuberculous mycobacterial, which is NTM infections.
All right, well, thanks, Dr. Khawar. Let me ask you a few questions. What is bronchiectasis?
So bronchiectasis is a condition where your airways are permanently dilated or widened out, producing excessive mucus or sputum, making it difficult for the patients to cough them out and can cause repeated lung infections. It's a progressive disease and it can cause long-term damage to the lungs.
How does bronchiectasis affect the lungs in the long run?
So it's an interconnected cycle of repeated lung infections, lung inflammation, excessive sputum production, and long-term lung damage.
And what causes bronchiectasis? How do you get it?
There are many conditions that can cause bronchiectasis. For example, repeated or recurrent lung infections. That can be pneumonia, that can be non-tuberculous mycobacterial infections or tuberculosis, aspiration, advanced COPD, certain inflammatory situations, for example, rheumatoid arthritis or inflammatory bowel diseases, anyone with a weakened immune system. Importantly, certain genetic conditions, for example, cystic fibrosis, alpha-1 antitrypsin deficiency, primary ciliary dyskinesia. So these are all the diseases that can cause bronchiectasis.
And how does it start? How does it present? What are the patient's first symptoms that they'd notice?
So usually patients will present with cough and sputum production, and that has been going on for months, sometimes years. And getting worse, they will have shortness of breath, they can have wheezing, and sometimes they will report that they produce blood in their sputum as well. In some situations, patients can have fever, they can have chills, they can have weight loss and overall fatigue. So that can all be related to diagnosis of bronchiectasis.
And how is it diagnosed? How do you find out if a patient has bronchiectasis?
So typically it is diagnosed by your pulmonologist, who will review your medical history and will obtain a high resolution CAT scan of the chest, certain blood workup, blood testing, certain genetic testing is needed, lung function testing, and some patients even need bronchoscopy for diagnosis.
So how is bronchiectasis treated or managed?
So common strategies for the treatment include airway clearance therapies, for example, positive expiratory pressure devices, vest therapy, certain nebulized medication, oral or nebulized antibiotics. And importantly, you have to treat the underlying cause that initially caused the diagnosis of bronchiectasis.
What does the TriHealth Multidisciplinary Bronchiectasis Clinic offer that's new in the region?
Yeah, so at TriHealth, we have a unique opportunity to create a multidisciplinary bronchiectasis center of excellence, which is one of its kind in the whole tri-state area. This clinic will be available for patients with a new diagnosis of bronchiectasis or anyone with a complex or advanced bronchiectasis, in particularly if they have a non-tuberculous mycobacterial or NTM infection. Our support staff or our team includes pulmonologist, infectious diseases specialist, and respiratory therapist, pharmacist, and they are all trained in the management and treatment of bronchiectasis. Patients will have a unique opportunity where they will see a pulmonologist, they will see an ID specialist, and they will see respiratory therapist in one clinic setting. And we can put our heads together and create a multidisciplinary diagnostic workup and comprehensive treatment plan for the patients. So Dr. Blatt, what are NTM?
So NTMs are certain very slow-growing bacteria that are distant cousins of tuberculosis. They're hard to identify unless you do very specific cultures to find those bacteria.
And what are the symptoms of NTM infection?
So many patients will have fever, shortness of breath, persistent cough, sometimes weight loss, night sweats. It really wears the patient out.
And what is the most common kind of NTM?
So the most common one that you'd probably read about is called Mycobacterium avium complex, or MAC. MAC is a very complicated organism, and it requires very complicated treatment.
And where do NTM infections come from?
Well, they're present in water sources, in the dirt, in dust, so we're always exposed to them constantly. Most people don't get them, but certain patients are at higher risk.
Who is at risk for NTM infection?
So patients who are elderly, patients who are immune suppressed, patients with certain underlying conditions like cystic fibrosis or other kinds of chronic lung conditions. And for some reason, for reasons we don't fully understand, older women are at higher risk.
And are NTM infections contagious from person to person?
No, fortunately, you can't catch these infections from someone else, so they're not like tuberculosis in that way. You can only catch it from the environment, but you can't give it to anyone else.
And how do you diagnose NTM infections?
So it requires very specific cultures. So sometimes patients can give us a sputum specimen, cough some up, and if we do the right tests in the lab, we will be able to identify it. Sometimes we have to ask our pulmonary colleagues to do a bronchoscopy test where they wash some sputum out of the lung and do special cultures.
And how are NTM infections treated?
So the treatment is usually very complicated. It requires sometimes 3 or 4 antibiotics for as long as 1 to 2 years. So it really requires a multi-specialized team of specialists, including pulmonologists, infectious disease doctors, respiratory therapists, and even our pharmacy colleagues to help us figure out the appropriate treatment for every individual patient.